regarding the Nipah virus in Kerala has raised concerns following the detection of antibodies in bat samples from the Malappuram district. Health Minister Veena George has announced that 6 out of the 27 fruit bat samples collected near Pandikad tested positive for Nipah antibodies. This comes after the death of a 14-year-old boy from the virus on July 21. So clearly there is a lot of concern in the state of Kerala right now. Despite the alarming findings, all the contacts of the deceased have tested negative for the Nipah virus so far. A total of 472 individuals were monitored, with 261 having completed the mandatory 21-day isolation and removed from the contact list. In fact, the authorities are also closely monitoring the situation to prevent any further spread of the virus, while also ensuring public safety measures are in place. All right, so this is again an important discussion that we'll be having right now. Let me just introduce our guests on the panel right now. Dr. Rajeev Jayadevan, who's a Vice Chairman of the Research Cell of IMA Kerala. Dr. Ishwar Gilada, Secretary General, the Organized Medicine Academic Guild, and also Jisha Surya, who's a journalist. I appreciate you all for taking your time out for this very important discussion right now. Let me start with Jisha Surya right now. Jisha, again, a lot of concern about the Nipah virus, and as it always has been from Kerala. Help us understand what's the current situation like right now, because again we see a lot of alarmist reporting as well across various outlets, but help us understand what exactly is the situation on ground.
This is the fifth outbreak since 2018, but as far as I understand, the Nipah scare this time has waned away. Unfortunately, we lost the index patient. It's a 14-year-old boy from Malappuram. But after that, no one has tested positive for this Nipah virus. And half of the 470 persons who were in the contact list also has completed the 21-day isolation period. So currently, the Nipah scare has waned. But this is the latest report that has come up. The antibody presence was detected in the bat, but health experts can confirm that this is not the first time this was reported. In previous cases, the first case in Kerala was reported in 2018 at Perambra in Kozhikode. That time, unfortunately, 17 persons were killed. That time, it was the health sector was not prepared for this. Kerala was totally caught off guard at that time. So almost 17 persons died at that time. And so far, 21 persons have died in the outbreaks that happened in 2018, 2019, 2021, 2023, and now this year. This year, the index first patient died, and he has reportedly consumed fruit, which is locally known. It's pork plum, locally known as ambaranya, and so that is suspected to be the reason for this infection. But since even after so many cases, we are yet to confirm the real cause of transmission, whether this is really from consumption of fruits or any other in coming in contact with the other secretions of the bat from public places. We are still not very sure about that. But this time, I think with this outbreak, we have this scare is slowly waning off because all have tested negative so far.
Absolutely. Like you rightly pointed out,